Good evening to everyone and welcome to today's session. I hope you're all doing a fast revision of the most focused MCQs in the preventive medicine. Totally, there are 1800 MCQs, of which already we discussed almost 1200 questions. Another 500 questions are there to discuss. We will take another 5-6 days before we say that we are ready to take up any question in the tomorrow's exam in the preventive medicine. So totally the duration of the entire PSM, these 1800 MCQs is spanning about 30 hours of duration. So all these videos are all uploaded into onlinemmbbs.com for you to do the revision. Good to see Priyanka Sharma and many more who are all online. Let's make the great beginning. What is a disability limitation? So if you rest the affected limb in a neutral position, then what you are doing is a disability limitation. Comprehensive emergency obstetric care. It includes blood transfusion, surgical procedure like cesarean, not hysterectomy, and the manual removal of the placenta. So these are all part of the comprehensive emergency obstetric care. In this context, you need to know what is meant by BIMONC and CIMONC. BIMONC is Basic Emergency Obstetric and Newborn Care. CIMONC is the Comprehensive Emergency Obstetric and Newborn Care. So under the BIMONC, 24-hour delivery and neonatal services, then 24/7 PHC, CHC, and the level 1 facilities. Level 1 facilities means PHC, subcenters, delivery points, manual vacuum aspiration, they're all level 1. So that is all included under the BIMONC. So manual removal of the placenta, antibiotics, anticonvulsants, uterotonics, vacuum-assisted delivery, newborn resuscitation, and the aspiration of the retained products of conception. They're all included under the BIMONC is what you need to emphatically remember. अच्छा भैया, CIMONC क्या होता है? Typically, the additional services, including the BIMONC services, then it is the district hospitals and the one first referral unit for every 500,000 population, 5 lakh population. So it has all components of the BIMONC. Additionally, blood transfusion is being provided, and surgical capability, that is cesarean section facility. So comprehensive care provides all 8 services: antibiotics, oxytocics, anticonvulsants, manual removal of placenta, removal of retained products, assisted vaginal delivery. Additionally, surgery with cesarean section and blood transfusion is also being part of the CIMONC, is what you need to emphatically remember. When the confidence level of the test is increased, what will happen? The previously insignificant values become significant. So what is meant by confidence interval? So there are certain levels which are being set, and in that interval, you expect a parameter value to fall in that interval. So it is the range that is likely to contain the population mean when obtained for repeated samples. That range is called confidence interval. So larger the sample size, narrower is the confidence interval. Smaller the standard deviation, narrower is the confidence interval. So confidence level is the level of the hope or expectation fixed at a sufficiently high level while dealing with the samples to ensure high reliability. So it is a degree of assurance for an interval to contain the value of the parameter is what you need to remember. So internationally, 95% confidence interval is accepted. And the maximum tolerance of probability of type 1 error is the probability that a confidence interval does not contain the population mean. So confidence level is equal to 1 minus alpha error. So already you know alpha errors are because of true positive and false positives, and beta errors are all because of the false negatives is what you need to remember. Which IUCD acts for a period of 10 years, doctor? All the intrauterine contraceptive devices approved years of use. A list है ना डॉक्टर, sure short पूछने वाला क्वेश्चन है. Copper IUD is 3 to 5 years. Progestin Sat is for 1 year. Copper T 200 is 4 years. Nova T is 5 years. Levonorgestrel containing IUD is 7 to 10 years. Copper T 380A is 10 years. बराबर याद रखना इस values को. So copper T 380A works for 10 years. Now, what is the least common complication of measles? SSPE is dangerous but least common. Leproman test is only a prognostic test but not a diagnostic test. Many times we discussed it, doctor. Still, 5 points about the Leproman test. Let us become confident. Leproman test is a test of cell-mediated immunity. 0.1 ml Leproman intradermally is being given, where inner aspect of forearm. There is a Dharmendra antigen excessively used in India, Mitsuda antigen, and the WHO recommended concentration of the Dharmendra antigen to be 1/16. Readings are done after 48 hours and after 21 days. Early reaction is Fernandez. Delayed reaction is called late Mitsuda reaction. So when will you read Fernandez, doctor? Within 48 hours. Redness more than 10 mm indicates positive test. It only means there is a prior exposure to infection. Early reaction is a delayed type hypersensitivity. Favorite question of the exam there. It is the soluble component of the leprosy bacilli that lead to this early reaction. It is superior to the late reaction. And the Mantoux test of TB and the Fernandez reaction of leprosy, they both are similar, is what you need to remember. Late reaction, a nodule more than 5 millimeters diameter is positive, indicates cell-mediated immunity. It is the bacillary component of the antigen, and the BCG vaccination can convert. If already BCG vaccination is being given, a late Mitsuda reaction, which was earlier negative, with the BCG will become positive. That's the point you need to appreciate. So what is the value of Leproman test, doctor? It is not a diagnostic test. It is only to know the cell-mediated immunity status of the patients. It will also help to classify the leprosy into borderline tuberculoid and tuberculoid leprosy, etc. The main drawback, it is not a diagnostic test. It is positive even in non-cases and negative in lepromatous cases. So if you look at the various types of leprosy, tuberculoid, intermittent, borderline tuberculoid, borderline lepromatous, and lepromatous leprosy, the different possibilities of the Leproman reaction is you need to remember. So in lepromatous leprosy, Leproman reaction become negative. This is what examiner is going to haunt you in tomorrow's entrance exam. If you want to compare the new test and the gold standard test, what is the best methodology? Bland and Altman analysis is being done. भैया इसके बारे में जरा एक दो पंक्तियों पढ़ाई करेंगे. Bland Altman test is not a statistical test which is measured with p-value. Basically, it is a process. When there are two methods of measurement, you want to see whether there is an agreement between the two methods of measurement. One is self-preparation with Dr. Murali Bharadwaz YouTube classes. Second is going to face-to-face classes in a crowded classroom. If you want to check these two methods, then bland Altman analysis should be done. So it is used to assess the level of agreement between two methods to compare a new technique with an established technique. Kolmogorov, Smirnoff, it's sounding like a vodka brand. Kolmogorov, Smirnoff test. It is a useful general non-parametric test to compare two samples. KS test. It is also called Kolmogorov-Smirnoff test. It is used to determine if two data sets differ significantly or not. Now, doctor, which is an accepted method of randomization? Computer drawn randomization. Randomly computer can pick up, lottery can pick up, random number table can be used, any of them. Thiamine deficiency can occur with diarrhea, alcoholism, and also a guy who is a food faddist. Thiamine deficiency can occur. The overall survival definitely is increased by screening in case of colon cancer. Any elderly person, doctor, please don't forget, any elderly person who presented to you with anemia, or any elderly person who presented with constipation, if you forget to get a colonoscopy done, you are missing a great possible diagnosis of colon carcinoma. Any elderly person with anemia, any elderly person with constipation, don't forget. आपको 75-year वाला grandpa आ गया, 78-year वाला grandpa आ गया. अगर उसको constipation है, anemia है, अगर आप colonoscopy नहीं कर पाया, then you are missing the colon carcinoma. Colorectal cancer is an ideal situation for screening. 6% of men and women. It is fatal in half of the cases. But if you detect it, it is curable at an early stage. LJ chart. It is used for monitoring what? It is used for monitoring the accuracy is what you need to remember. So, pehla doctor, what is validity? What is reliability? What is accuracy? You have to be very sure. Validity hota hai the extent the test measures what it is expected to measure. बंदरी को बंदरी, सुंदरी को सुंदरी जानना चाहे तो जो सुंदरी को पकड़ना है, अगर वो बंदरी को पकड़ रहा है, then validity is not good. सुंदरी को सुंदरी के जैसे बंदरी को बंदरी के जैसे पकड़े तो validity is good. So validity has two components: sensitivity, specificity. So what is the inherent property of a screening test, doctor? Sensitivity, specificity and predictive accuracy. अच्छा भैया, accuracy क्या होता है? You have calculated a value and there is an actual value. How close is your calculated quantity to that of the actual true value? That is called accuracy. Precision होता है. If you are repeating a test, every time you are repeating, are you getting the same results consistently or not? That is what precision is doing. Precision को बोलते हैं reliability, repeatability, consistency, reproducibility. जो भी बोलो, अंग्रेजी में बहुत synonyms होते हैं. So reliability is about precision, validity is about accuracy. So Levy-Jennings chart is a test of accuracy and also the test of loss of precision. That is what you need to appreciate. So doctor, precision versus accuracy. Repeatability, reliability, consistency, reproducibility of a test is called precision. R-chart, range chart are used. The degree of closeness of the measured to that of the actual true value is called accuracy. Mean chart, Levy-Jennings chart, Schubert control chart are the ones which are used for measuring the accuracy, is what you need to remember. देखो, this is a simple illustration. A accurate भी है और precise भी है. एकदम bullseye is hit. It is not accurate, कहीं और जाके लग रहा है. This is imprecise. Bullseye hitting, surrounding area hitting. This is neither accurate nor precise. So, imprecise precision error is basically reproducibility error. Accuracy is a systematic error. That's what you need to remember. So, what is this called? Accurate and precise. Precise but not accurate. And neither accurate nor precise. That is what you need to remember. And this is accurate but not precise. No, doctor. The mean hemoglobin of a sample of 100 pregnant women was 10 standard error is 1. Already बहुत बार हमने discuss कर चुके हैं इसको. Standard error is equal to standard deviation divided by square root of the number of people. So, the standard error is standard deviation divided by square root of sample size. In this case, 1 by square root of 100 is equal to 0.1 is what you need to remember. So, some of the questions keep repeating because All India NEET PG AIMS exam, All India Postgraduate Medical Entrance Doctor, 2000 to 2016 तक इनका हवा चला. 2016 to 2020 नीट पीजी का हवा चल रहा है. बाद में नेक्स्ट बोल रहे हैं लोग. नेक्स्ट आने के पहले ही खत्म करो अपना नीट पीजी का जर्नी बेटर. और एम्स का 2000 to 2020 अभी तो वो INI-CET आ गया ना, एम्स चले गया. But this question bank of 20 years of AIMS and 20 years of AIPG is all that you need to revise in all 19 subjects. Then nobody can stop you from becoming a winner doctor. समझ में आ गया? So totally एक 20,000 unique MCQs होता है. Unique questions. इन दोनों को अगर आप रिवीजन करें तो AIPG एंड एम्स ऑल 19 सब्जेक्ट्स में Already we have discussed a lot of this and made available 1500 HD videos in the onlinemmbbs.com video library, topic wise. So please take every opportunity to subscribe and do the revision. So standard error of the mean is standard deviation divided by square root of the number of people. In a screening test, it should have high specificity. अगर आप स्क्रीनिंग करें और विदाउट स्पेसिफिसिटी करें तो lot of false positive people will become detected and unnecessarily वो डर जाएगा, right? False positives bring discredit to a screening test. Brucella is by ingestion, aerosol, and contact of aborted fetuses. Then, true about Asha, 1 per 1,000, mobilizer of antenatal care, and she is a female voluntary worker. She is not a birth attendant. Dai will be the birth attendant. Disease not transmitted by lice. Q fever is not transmitted. Epidemic fever, trench fever, relapsing fever. Chlorine demand, Horrocks apparatus. Vitamin D is very rich in fish oil. Vision 2020 में क्या क्या include किया हुआ? Trachoma, cataract, and onchocerciasis. Kala azar is transmitted by sandfly. Dietary reference intake recommendations. Upper tolerable level, adequate level, recommended daily elements, RDA, they're all dietary reference recommendations. Epidemic dropsy is because of sanguvarin, is what you need to remember. Apologize me if I'm running really fast, because this has been discussed. There are totally 1800 MCQs. We are discussing, most of the concepts are all revised. These 1800 MCQs are based on AIMS and AI PG, NEET PG, past 20 years. Already we finished almost 1200 MCQs. Another 600 are there, khatam karenge. Pura 25 घंटे, almost 25 hours of your time you have to invest to do the revision. If you want, you can go back to the onlinemmbbs.com video library. After this class is over, we purposefully delete this video from the YouTube. We will process the video and upload it into the onlinemmbbs.com along with the PowerPoint. Isliye, please, thank you all for coming to this live class. Without students, teacher does not get inspiration to teach. But when you want to play back and do the revision, you need to be a paid student on the onlinemmbbs.com. The first case which comes to the attention of the investigator ko bolte hain index case. Good to see Ramesh Bashir. Very happy Pongal, Bashir. So, index case. Sub center level में कौन रहता है? Except, actually, this is an except question. Medical officer will not be there in the sub center. Now, primary health care. Thanks for the compliment, Bashir. So Bashir, from which part of the country you are, and what is your dream branch? On the eve of Sankranti, let us pray the God that Dr. Bashir gets his dream MD seat. Please punch which city you are from and what is your dream branch. Today we will open up a wish list for you. Primary health care. Essential health care for all. You put the people's health in people's hands. And very good, from Kerala, very good. Orthopedics. Excellent. So we will pray tonight that Bashir will get his dream seat of MS Ortho. To become a topper in entrance, doctor, you don't need a lot of knowledge, lot of money to spend, lot of anxiety. जरूरत नहीं है. रोज आपके साथ बैठ के पढ़ाई करने के लिए, to study along with you, you require one companion. Dr. Murali Bharadwaz is available. You need to have a focus. What are the 950 topics that you are going to do the revision? That is already there in the onlinemmbbs.com video library. Then you need to have a clear set of notes of 20,000 points. That is also there in the PowerPoints in the onlinemmbbs.com video library. That's more than enough. You will become a winner. And you don't need more than 4 months of time to study. Not more than 400 hours of your time to study, honestly. So that's how I had an opportunity to mentor almost 2 lakh medical students and wonderful doctors like you who are the top consultants now. Some of them are head of the departments of various medical colleges. Every time I meet them, I feel so happy that 20 years back, 10 years back, when they are preparing for entrance, I had an opportunity to mentor them the way I am able to do for you all guys. So when I look back at them, they had the same insecurities, same apprehensions, similar anxieties as what you are carrying today. But the point is, the moment you are focused, the moment you are perseverant, the moment you are cracked all the logical areas like in pharmacology, general medicine, there's some logical topics. Well, logical cheezon pakadna. There'll be around 5,000-6,000 factual details like kaun banega karodpati or a Bornavita quiz contest. Usko bhi pakad ke mutti mein rakhna. Then nobody is going to stop you from becoming the winner. Right, doctor? So please don't forget, every day 6 p.m. you have Dr. Murali Bharadwaz, all 365 days, absolutely free on the YouTube. So please take every chance to join the evening session. Before we start the class, we put up few MCQs and you take it like a quiz, exercise your mind, and then we will have a discussion. Right, doctor? Under National Prevention of Control of Blindness, screening of the school children kaun karega? School teacher. When the outcome is compared with the intended objectives, that is called evaluation. Active search in a healthy individual is called screening. Now, regarding the fluorosis can cause fluoride deposition in the bones, defluoridation by Nalgonda technique, and the fluorosis leads to weakening of the bones leading to genualgum is what you need to remember. So what is the recommended level of the drinking water? Fluorine levels, doctor, 0.5 to 0.8 milligram per liter. Once more, factual question आ गया. अगर ये नहीं पढ़ के गए तो, if you have gone to exam without reading this, how can you answer in the entrance? You can't. You break your head also in exam hall, you can't. And one time at least you should know that this is tested, factual, numerical, that I need to mug it, by heart it and eat it, swallow it and vomit it in the tomorrow's exam. Be sure. That is the reason NEET PG is not a test of intelligence. It is a test of focus, test of perseverance, test of willpower, test of a great dream, test of a great aspiration, test of a positive outlook, and time management. Right? You're all with me? So, doctor, the optimum level of the fluorides in drinking water, 1 to 2 milligram per liter. What is the major source of fluorine to man? Drinking water. And if the level is more than 1.5 ppm, dental fluorosis. 3 to 6 ppm, skeletal fluorosis. More than 10 ppm, crippling fluorosis. That is what you need to remember. Dental fluorosis occurs when excess fluoride is ingested during the first 7 years of life. It occurs at a level of 1.5 milligram per liter intake. It is characterized by mottling. And where do you see mottling, doctor? Incisors of the upper jaw is what you need to remember. Nalgonda technique was developed by National Environmental Engineering Research Institute, NEERI, Nagpur. So what do you add? Lime, alum, bleach powder, flocculation, sedimentation, filtration, etc., etc. Prevalence of the disease is increased by the duration of the disease. Maternal mortality typically is number of deaths from the puerperal causes in a given population in a given year divided by number of live births registered in the same population in 2000 is called maternal mortality. Pulse polio immunization. Mopping is done in areas where wild polio virus is found. And very important thing is, what is the age group where you do the surveillance is an important question. Acute flaccid paralysis is defined at the onset of paralysis less than 4 weeks. That's the reason acute. In a child less than 15 years, for which no obvious cause is being found. Reporting of all AFP cases less than 15 years is mandatory in India. And all AFP cases should be evaluated within 48 hours. Then the non-polio AFP is an indicator of surveillance sensitivity. If it is less than 1 per 1 lakh children below age of 15 per year, then the surveillance system is probably missing the AFPs. The adequate stool sample collected from more than 80% of AFP cases. These are all the measures of dispersion except the range, mode, variance, standard deviation. They are all measures of dispersion, how the data is dispersed. For the blood spills, we use sodium hypochlorite. PUFA is present in fish oil, corn oil, mustard oil. In the National Water Supply and Sanitation Program, problem village. अगर safe water लाने के लिए एक घर का महिला 1.6 किलोमीटर से दूर जा रहे तो इसको बोलते हैं प्रॉब्लम विलेज. एंडेमिक ascites, pyrolysidin, disability limitation, neutral position of the limb. Specificity measures, true negatives. Life cycle of the filaria is an example of cyclo-developmental process. The other day we discussed. Disease agent undergoes only cyclical change in the body of the vector, like filarial parasite in culex, guinea worm embryo in cyclops. Cyclopropagative disease agent undergoes cyclical change and multiplies in the body of the vector. That is malarial parasite in Anopheles mosquitoes. Propagative disease agent only multiplies in the body of vector. Like it only multiplies, does not change the form. Yellow fever in Aedes, plague bacilli in rat fleas. Indian reference male is 60 kgs, 8 hours in bed, 20 to 39. DPT vaccine का adjuvant is aluminium. Maximum maternal mortality is all due to hemorrhage. The best distribution to study the daily admission of head injury patients in a trauma care center is the Poisson distribution. अच्छा, इसके बारे में पढ़ाई करेंगे. What is Poisson distribution? Poisson distribution is a discrete probability distribution where the probability of a number of events occurring in a fixed period of time is being calculated. It is used for the number of events in other specified intervals, not only time, even distance, area or a volume. So, daily admission of the head injury patients in a trauma care center probability कितने लोग accident होके head injury करके आएगा? How will you know? Poisson distribution. It was started by the French mathematician Dr. Simon Denis Poisson. So there are two types of distributions you should know: binomial distribution, Poisson distribution. So if you look at the Poisson distribution, the key assumption is the random variable counts the number of events that take place in a given interval. And there are so many use case scenarios where Poisson distribution is used to control the statistics, to count the number of defects of an item, in the biology to count the number of bacteria, or you want to know how many typographic errors are there in a printed material. Poisson distribution. So one of the Russian scientists, Leproman in 1898, has used it to investigate the number of soldiers in the Russian army killed accidentally by the horse kicking. Poisson distribution. The mean bone density between two groups of 50 people each is compared with each other. So when you are comparing the means, what is a constant variable like blood pressure, height, weight, then you use the student t-test. But if you are comparing proportions, then you use the chi-square, as all of you know very well. So this earlier discussions also we discussed parametric, non-parametric tests, and what are the tests of significance. What is the meaning of a p-value of 0.01? So it means to say that the difference is not significant 1% of times. 1 by 100 is 0.01. So it is significant in 99% of times. That is the meaning of the p-value. If mean is less than median, then the data is called negatively skewed data. Now, coefficient of variance. For the BP and the serum creatinine is found to be 20% and 15%. What is the meaning of coefficient of variance and how do you interpret it? Since coefficient of variance for the BP is more, 20%, than the creatinine, which is 15%, that means the variation in the BP is more than in the serum creatinine is what you need to remember. So, in a study, on a population in UK, it has been found a antiarrhythmic drug sales and deaths in asthma are related. But here the unit of study is what? Population. That's the reason it is an example of ecological study. Occupational cancers can involve lung, bladder, and liver. Asbestos, mesothelioma, arsenic, skin, lung, and liver. Benzene lead to leukemia. Benzidine lead to urinary bladder. Beryllium, cadmium lead to lung cancer. Nickel lead to nasal sinus and lung cancer. Radon, silica, vinyl chloride, if you take radon, silica lead to lung cancer. Polycyclic aromatic hydrocarbons can lead to skin, scrotum, and lung. Wood dust lead to nasal sinus. Vinyl chloride lead to liver. A list, doctor, garmadaram yaad rakhna. For the enteric fever, how long you want to isolate? Till 3 bacteriologically negative stools and urine reports are achieved. You need to isolate. So, isolation versus quarantine, you have to be sure. Separation of cases is isolation. Done for cases themselves. It is the early diagnosis and treatment because they are all cases. So it is a level of prevention is secondary level and duration is still recovery. That is period of communicability. Whereas quarantine is for healthy contacts and it is done for the other persons around and it is specific protection. So primary, this level of prevention. Quarantine level of prevention is primary. Isolation level of prevention is secondary. Don't forget, that is a favorite MCQ. And quarantine is done till the maximum incubation period is what you need to remember. Net protein utilization. It is the ratio of the total nitrogen retained by the total nitrogen taken in multiplied by 100. So NPU, nitrogen retained by body by nitrogen intake into 100. Otherwise, biological value into digestibility coefficient divided by 100 will give you the NPU. NPU अंडा को कितना होता है, दूध में कितना होता है. अरे बाप, एग्जामिनर छोड़ेगा नहीं. You have to remember all this. NP of egg is 96, milk is 81, rice is 65, pulses is 45 to 50, groundnut is 50, wheat is 51. So please don't forget. So cyclodevelopmental life cycle is filaria. Post-pasteurized milk quality. It is the phosphatase test which is used to detect. To know the contraceptive efficacy, I know you will all answer this question wrong. Come on, doctor, punch your answer. Online classmates. Kalavati, Bashir, Priyanka, punch your answer. I am waiting for your answer. What is the best index for measuring the contraceptive efficacy? Entrance exam में ऐसे क्वेश्चंस की हमको बहुत सताएगा. I know what is your answer. I know what is the wrong answer and right answer. Come on, punch your answers. I'm waiting. So, doctor, yeah. Please punch your answer. So, a lot of us will think Pearl Index. Pearl Index is a measure of contraceptive efficacy, everyone knows. But that is not the answer. That is not the answer. Life table analysis. So Pearl Index, life table analysis, both of them are used. Pearl index is most common index. But life table analysis as a measure of contraceptive efficacy, it calculates the failure rate per month of use. It is a better measure than the Pearl index is what you need to remember. The goals of national population policy. Already we discussed this question. The list of the goals, Doctor. Paris green, gambusia, intermittent irrigation, they're all larvicidal methods. So how does DDT basically work? Pyrethrum has a synergistic action. DDT is a contact poison. Residual effect will last for about 18 months. It does not immediately kill the prey. And it does not dissolve in water. It remains as an environmental pollutant. That is the problem with DDT. Paul Muller was awarded Nobel Prize in Medicine in 1948. DDT is a pesticide. It is a persistent organic pollutant. Dichloro, diphenyl, trichloroethane, very rhyme-like word when we were in 12th class, organic chemistry mein. I still remember dichloro, diphenyl, trichloroethane was very rhythmic word, right? So it does not easily wash out of the environment because it does not dissolve in water, and it is one of the major environmental pollutants is what you need to remember. Incineration, it is not done for. It is done for cytotoxic drugs, cotton contaminated with blood, human tissue, not for waste shops. Shortest incubation period, obviously, for influenza. About the BCG vaccination, WHO recommends Danish 1331 strain. Leproman test is used for prognosis, not diagnosis. Kaplan-Meier's method, it is used for survival. Survival of the study population, easy to calculate, non-parametric estimate, commonly used to compare the two study populations. It is applicable for both small, moderate, and even large samples, is what you need to remember. With regard to the vaccines, kanamycin is used as a preservative in measles. Magnesium chloride is a stabilizer in OPV. Thiomercerol is a preservative in DPT vaccine. They're all the true statements is what you need to remember. So, Doctor, आज की हरिकथा कालक्षेप समाप्त हो गया. भक्तजनों, अपने दिल लगा के next 90 days में give your best and expect the best to come as a result. Okay? So don't worry about result. You're all going to make it. Only thing is, remain in the game. Every day evening, please come to the live class with Dr. Murali Bharadwaz, all 365 days. See you all tomorrow evening. Thank you.